going to welcome our first keynote speakers, so Professor Breda Smith, Chief Medical Officer, and also Pierre Dulceau, just to come up to the stage here, and then Breda will kick us off. So if you hear from me for the rest of the event, it'll be a little signposting and a little keeping us all on track. But you're very welcome and delighted to have you here today. Thanks. So over to you, Breda.
Thanks very much, Sarah. Sarah and the team have been working really, really hard on this event, and I want to thank you all for all the efforts that have gone in to make this happen. So you're all very welcome today, and I'm delighted to see you all here for this event as part of EU50. Today's event is part of the Government of Ireland's EU50 series, as you're aware of. This year marks 50 years of Ireland's EU membership, and we are celebrating this milestone with a year-long programme of events led by the Department of Foreign Affairs. We are bringing together policymakers from across government departments, sectors and the population to celebrate and reflect on Ireland's membership and to look to the future of our union. So firstly, let us reflect really. Ireland's EU membership over the last 50 years has coincided with radical and transformational change of our population, of our social and economic landscape, and of the landscape of our health system and the health of the nation. Over the 50 years, there have been significant changes. In the 70s, our population was approximately 3 million. Now, in 2022, it's over 5 million. Within that population, in the 70s, 11% were over the age of 65. Now we have nearly 16% in this age cohort. Similarly, in the 70s, over 30% were children. Now we only have 25% of our population are children. Likewise, actually, our lives and our lifestyles have changed significantly. Can you imagine in the 70s, 70% of men smoked and 40% of women. We've been very successful really in reducing this rate, and currently 19% of men and 15% of women smoke, but this is still a long way off our target of 5%. Similarly, alcohol consumption has changed, but unfortunately in the wrong direction. In the 70s, our average consumption per capita was 7 litres. Today in Ireland, it's 12.75 litres per capita. Also, unfortunately, we have been performing poorly in the area of obesity. In the 70s, imagine 1 in 100 children were obese. Today, 1 in 5 children are either overweight or obese. So even though we have gained significant successes, we still have significant health challenges with regards to our health and the health of the nation. The EU, of course, has played a critical role in supporting public health in Ireland over these 50 years. We know that the Treaty on the Foundation of the EU designates public health as a shared competence. Therefore, collaboration between Member States and the European Commission is absolutely essential. There are many examples of the EU's contribution to enhancing health protection, health intelligence, health service improvement, and health improvement in support of Member States. The EU has played a vital role in setting legal standards for food safety and medicines. It has significantly complemented the work of Ireland in the area of tobacco and alcohol policy, and we are particularly proud of how an Irish-led directive has helped to ensure common rules for tobacco sales and marketing across Europe. Also, it has played a vital role in coordinating Member States' actions on non-communicable diseases. It has developed pharmaceutical legislation and supported advances in digital and e-health. Many of these initiatives are currently also being strengthened under the wider European Health Union package, with the development of the EU Pharmaceutical Strategy, the Europe's Beating Cancer Plan, and the newly launched European Health Data Space, working to improve healthcare delivery across the EU. This morning in particular, we will focus on health emergency preparedness, reflecting on lessons learned from COVID-19 about the European and national capacity to effectively respond to cross-border threats, and looking forward, asking ourselves, how do Europe and Ireland need to strengthen our preparedness and response to public health emergencies to build on what we have learned? In my roles as currently as Chief Medical Officer, but also previously as a member of NEFIT, at the National Public Health Emergency Team, and as the Director of Public Health in HSE West, I am proud of Ireland's ongoing response to COVID-19 overall. There were many strengths to our response, however, we must also reflect on the challenges. Our systems rapidly adapted to the unprecedented challenge, thanks in no small part to each and every one of you in this room today, and also to the resilience of our healthcare staff. We witnessed how our vulnerable populations in our society were most affected, particularly our elderly and also our marginalised groups. Similar to other jurisdictions, we experienced outbreaks in our residential settings, our nursing homes, and also our meat factories and in areas of lower socioeconomic disadvantage. We also learned how effective communications proved essential in building trust in the public. We incorporated behavioural insights into these programmes, and we must continue to build on this success. We also learned the value of data and analysis, and it's an essential component as part of the effective public health response, and this is an area we must continue to strengthen. We have also learned that adaptability and surge capacity is necessary to be adequately prepared for emerging health threats, and the health system must be supported to ensure continuity of care and minimise health service disruption in the face of public health challenges. However, this process of reflection on Ireland's lessons learned is not just a once-off, it must be ongoing. I am grateful for the recent extensive work of the Public Health Reform Expert Advisory Group, which reviewed the public health lessons learned from COVID, and I very much look forward to the upcoming publication of the group's recommendations. As we seek to apply the learnings from this extremely challenging period, Ireland is currently implementing a range of important reforms that will improve public health and address some of the challenges that have been identified. Firstly, I look forward to implementing the recommendations of the Brady Report and of the Public Health Expert Advisory Group. In addition, in 2023, we will continue to expand our public health workforce, strengthen surveillance, procure an outbreak management system, and develop our modelling capacity and capability. We will continue to support research and evidence synthesis and other functions that have proven essential in the COVID-19 response. We are working to tackle significant public health threats, for example, the implementation of Ireland's second One Health National Action Plan on antimicrobial resistance. And also we are working to strengthen our health intelligence through the Health Information Bill and to support our vision of a modern, integrated health data system that facilitates and enables data flow on the end-to-end patient pathway. Also, from a policy perspective, Sláintecare is our policy that will help us to provide universal health care for all. So as well as these lessons at a national level, COVID-19 has reinforced the many benefits of European collaboration, particularly in this field of public health emergency preparedness and response. Ireland is both appreciative and proud of the EU's performance with regards to the procurement of the COVID-19 vaccines, which was essential to our highly successful vaccination programme. EU collaboration led to the rapid development of the digital COVID certificate, which facilitated us all to have safe travel across the Union. During the crisis, our ability to understand the evolution of COVID-19 and to carry out effective threat assessment depended on our sharing of knowledge and expertise through forums such as the ECDC, the Health Security Committee, and the leadership of DG Sante. Also, clear communications from the EMA, along with the work of Ireland's National Immunisation Advisory Committee, played an essential role in building trust and confidence in COVID-19 vaccines, a significant factor in the success of our vaccination programme. We are also very proud of the role the EU has played in international vaccine sharing and solidarity through Team Europe's leadership with COVAX and Gavi. Despite the successes of collaboration, it is also clear at the outset of the COVID-19 pandemic the world was inadequately prepared to respond to the challenge that lay ahead. This lack of preparedness was felt globally and acutely in Europe. But the EU has wasted no time in ensuring that the lessons learned from this pandemic are already helping to strengthen the EU's role in the public health crisis. In recent months, we have seen the recent passing of new regulations on serious cross-border threats to health, to oversee surveillance of communicable diseases, threat and risk assessment, and joint procurement. New regulations also to significantly expand the mandate and powers of the ECDC and the EMA, and the establishment of the Health Emergency Preparedness and Response Authority as a new directorate, and I'm really delighted to welcome its Director General, Pierre Delceau, here with us today. Ireland is very supportive of these developments and looks forward to working with our European partners. It has been a great pleasure in recent months to take up my role as Ireland's national representative to the HERA board, which is advising on HERA's priorities, work programme and approach. We are already witnessing the impact of HERA as we work on addressing current cross-border health challenges, whether in supporting Ireland to secure access to therapeutics to treat monkeypox, accessing information on public health threats arising from the conflict in Ukraine, or rapidly understanding the risks from the current Ebola outbreak in Uganda. The strengthened emergency preparedness role of HERA and the EU is already paying dividends for Member States and for Ireland. So now I would like to introduce our keynote speakers, and it's with great pleasure that I introduce the leaders of these major developments and of these significant organisations. Firstly, a very warm welcome to Dr. Andrea Amond, Director of ECDC, Emer Cook, Executive Director of EMA, and Pierre Delceau, Director of HERA. And I would now like to hand over to Pierre, who's going to give his keynote speech. Thank you very much. Thank you.
Thank you very much, Breda. Good morning to everybody. It's an honor to be here and to be here also for celebrating also the 50 years of accession of Ireland to the EU. But it's also a pleasure because, you know, Ireland is really part of the EU. And I have the feeling also that the EU is really part of Ireland. So being here is nice. You know, the weather is a Belgian weather. I'm Belgian, so that's okay. And we won yesterday, even if we did not deserve to win. But anyway, so let's start on positive aspects, you know. Now, I would like maybe to focus on the role of HERA and to see why we're here and why we have been created after the COVID crisis. And of course, when you want to look at the future, it's always good to try to draw the lesson from the past. And I know that you are working on this in Ireland, but also we've been working on this in different parts of the EU. Maybe the first message I would like to convey to you when looking at the lesson for the COVID crisis. I look at you. Nobody is wearing a mask. Everybody is shaking hands. We have forgotten about the COVID crisis, all of us. Despite the fact that still people are still being hospitalized, that people are still dying, less than before, but still we have forgotten about the crisis. And that's a mistake. Because we know one thing for sure, that health crisis will be there again in the future. And so maybe the first message I would like to convey to you, we have short memories, all of us. I don't wear a mask. But we should never forget that health issues are important and can destroy our economy, our citizens, our social life. So we need to take that dimension into account. And I fully understand that we have other priorities. We have the energy crisis, Ukraine war, all the consequences, which are terrible, of course, and that's clear. But despite all this, we still have a duty to be ready for the next health crisis. We should not forget about it. The second maybe lesson from the COVID crisis, I told you I'm Belgian, very proudly, despite our not very good win yesterday. Without Europe, simply, we would not be there. Without the common response, we would not be in a situation in which we are. I say I'm Belgium, I'm a small member state, Ireland is also a small member state. Without the collective effort of Europe, it would have not been possible to get access to the vaccines, to start vaccinating the population, to give an equal access to everybody. So we need a collective answer because we need to be realistic. When you have an health crisis, only Europe has a size which is sufficient to fight against the crisis. And the third element, which explains also why ERA has been created, is the fact that we need better preparation. And the point being that we need to start the preparation now, even if the next health crisis will be in 5 years, 10 years, 20 years, I don't know. But if we don't start the preparation now, I know one thing for sure, that when this health crisis will take place, people at that moment will say, if we are not prepared, what have you been doing during all those years? So we have a duty to continue to invest in preparation, even if it's difficult to convey this message to politicians, even if it's difficult to convey the message to population, we have a duty to do it. And things can change very quickly. I remember a year ago, we were in November, and people were saying, COVID is over. And then suddenly happens in South Africa. And 3 weeks later, it was in Europe, despite all the measures we took. And then it was a panic. Member states say, we have again COVID, we need to take measures. So we need to continue to invest in preparation. So ERA has been created, as you say, Breda, as part of the response. Now, ERA doesn't work in vacuum. We have excellent relationship with the two partners who are going to speak after me, Andrea Amon and Emmer Cook. In no particular order, it could be Emmer or Andrea, I don't care. The point is, we have excellent cooperation, and that's normal, because one also important message is we need to make sure that we join forces. We need to work together. We need to work together at EU level. We need to work together also with all 27 member states. So ERA has been created only a year ago. We are still very new, Actually, we are celebrating in Brussels. I'm making some publicity for you, but on the 8th of December, we are organizing a big event, a one-year conference in Brussels, simply just to explain what we've been doing during this 1 year. And ERA, as you may know, have two ways of functioning. One, which is a crisis mode, so when there is a health crisis. Another one, which is preparedness. So if you allow me, and actually even if you don't allow me, I'm going to focus first on the crisis mode and then on the preparedness mode. Crisis mode. I told you we are not yet out of the COVID crisis. We still have variants which are there. So far, so good, I would say, but winter is coming, famous series for those, who may know it. So winter is coming, and we don't know what's going to happen to this winter. So I'm not too pessimistic, that's not my message. But it's part of our duty to make sure that we are ready for winter, and we have enough, in other words, enough vaccines being there for the population if they want to be vaccinated. On the vaccine strategy, the fact that we have collectively purchased so many vaccines together, it has been criticized. But again, without it, many member states, many people in Europe would simply have not access to vaccines. I still remember the time when countries like Japan, Canada, Australia, I'm not talking about small, unknown, developing countries, I'm talking about those countries, they were begging Europe to give them some vaccines, to authorize some vaccines to be given them. And actually, they were vaccinated thanks to vaccines coming from Europe. So the fact that the vaccine strategy was a success. Now, of course, I know there are criticisms. We have too many vaccines. But who could have said it in advance? Nobody. When I take an insurance for my house or for my car, every year I have to pay a huge amount, too much money for it. I don't have an accident. So why do I pay it? For the case I have an accident. That's exactly the same for the vaccine strategy. We simply need to have the vaccines available if there is an accident, hoping that there will not be an accident. Second role of ERA in crisis time, second example, monkeypox. Again, monkeypox was something coming suddenly just before the summer. It was relatively a surprise for everybody. And I would say for the first time, maybe, I'm not sure you'll make the book of history, but for the first time, as ERA, we've done something which has never been done before in the EU. We have purchased vaccines with the EU money, and then we have donated those vaccines to the member states. That was the first time that it was done. And that's the way we should react in future health crises. And again, what was the reason? There was only one producer of the vaccines, relatively small producers. And when some member states, even big member states, went to see this producer, the reaction of this producer was, sorry guys, even if you are a big member state, you are not big enough for me, I'm not interested in selling to you my vaccine. That was the exact reaction. When we came as ERA, and we say we are going to purchase on behalf of 27 member states, immediately they reacted and they were willing to sign a contract with us. And we have done it very quickly, and again, we have donated the vaccines to the member states. And we have done the same thing also for the antivirals, for the treatments which were available. That's the way we should function in the future. And maybe the last point on crisis mode, unfortunately, I already made a reference to it, is Ukraine and the health consequences of Ukraine. And I have excellent colleagues who are working on this issue. I have one over there, Gary. He's from Ireland, so, by definition, he's excellent. But anyway, he's working a lot on what we can do to try to help Ukraine and to face the situation, which goes from many aspects, giving access to some drugs, some treatment, also COVID vaccines. So we are helping them to the extent it's possible. So that's the crisis mode of ERA. To sum up, I would say, we are there to react quickly on behalf of the member states and to help you as fast as possible when there is a crisis. Second dimension, preparation. And I told you that's key, that's fundamental. We have a budget, as you know, of more 1 billion a year to be invested in preparation. What does it mean? First of all, we believe it's part to set priorities, to try to identify what are the future health threats. And we have already done it. We have published a list of 3 main health threats that we consider on which we need to work now. First, you have a list of pathogens, which fundamentally could become, could create a pandemic, first element. Second element, you mentioned it, AMR, antimicrobial resistance, because it's already there, killing people. Third dimension, CBRN, which unfortunately is a situation that we have to face, taking into account the current situation. So as ERA, we have prioritized those 3 main health threats. Again, talking to experts, talking to member states, talking to my colleagues from ECDC and EMA. So it's not something that we have done in isolation. What are we doing now? We are working on the medical countermeasures which are needed. What does it mean? First, investment in research and development. People are always amazed and say, vaccines were available, COVID vaccines were available in a few months' time. Yes and no. Because actually there was a result of long-term investment in research and development. mRNA technology is not something which has been developed in 6 months. It's something which has been developed during a long time. So we need to continue to invest in research and development because we believe this is something which is important. Third dimension, we need also to make sure that we have production facilities available. So we are working on building strong production facilities in Europe, all across Europe, because this is a very key element. And final element, we need to do stockpiling. We simply need to purchase equipment, drugs, therapeutics, which are needed if there is a crisis. That's what we are doing as ERA. But again, as a conclusion, because I've been reminded that I was already too long, as a conclusion, I would simply say, ERA has been created not to create duplication, not to take precedence over the member states. The way I see the role of ERA is creating a cooperation between all member states, between all EU agencies, and also with the rest of the world, because we talk to the Americans, we talk to the Japanese, we talk to Africa, we talk to the WHO. We need simply to use all available resources together and work together in the same direction, because that's the only way in which we can achieve what we need to achieve, which is to be better prepared for the next health crisis. Thank you very much.
Thank you very much, Pierre. Thank you. So our next speaker now is Andrea Armand, Director of the ECDC, and we are relying on our technology now to beam Andrea into the room to us.
Dear Professor Smith, dear Pierre, dear Emma, dear colleagues in Ireland, thank you so much for inviting me for your celebration today. And although I cannot join you in person, I would send you my warmest regards and congratulations for your anniversary. Ireland has been a very long-standing partner in our collaboration, and I really would thank all the colleagues over those many years for the constructive exchanges of views and your support. When I look back to ECDC's work with emergencies, we actually started with that in 2005, the year the agency became operational, where there was a major H5N1 epidemic among birds, but then also the worry was that it goes to humans. And in the course of the last 17 years, we have worked in the H1N1 pandemic, in the Zika epidemic, and also in the outbreak of Ebola in West Africa, and lately in the Democratic Republic of Congo. Now, I think the COVID pandemic has proven to us what we knew already, that a serious threat to health caused by infectious diseases are inherently cross-border, not only in the EU, but globally. And that means that also the cooperation and coordination in the EU and globally was emphasized by the pandemic. This is why we have been always, and especially in the past 3 years, been working and liaising with EU and EEA member states, but also with the EU institutions, DG Santé, DG HERA, with the EU agencies like EMA and others, and many others actually, and also with international partners, WHO, and many CDCs around the world. But also in the neighboring countries. So when we go a bit more specifically to our work during the pandemic, we have constantly put out the updated data to map the progress or decrease of the pandemic, and also provided risk assessments so that health authorities in the member states could take the decisions that were increasingly complex. And we have put out standardized protocols for surveillance, even though some member states then did definitely something else. Here I'm not talking about Ireland. And produced technical guidance documents, and also supported preparedness and response activities. And in particular, the guidance documents in the past, let's say 2 years, were about vaccination activities. And last year, with the support of the Commission as part of the HERA incubator, we rolled out grants to fund whole genome sequencing infrastructure in the countries, and including Ireland. In monkeypox, the other emergency that came this year, we started from the very beginning joint work in surveillance and other activities with WHO Europe, and have since published regularly a bulletin for the European region together. And we have done the risk communication and community engagement strategies with WHO, but also with the respective communities, it developed also a communication toolkit for event organizers, because it was particularly in the summer. And all this has led, I think, together with the vaccination activities, also now to a decrease in cases. Regarding the humanitarian crisis in Ukraine, and we have had since beginning of March very regularly meetings with colleagues from member states neighboring Ukraine, but then also with everybody in the EU, because everybody has taken in refugees. And we are now following up on some of these activities, and in 2 weeks we will have a pilot face-to-face trainer course to train the particular healthcare providers on vaccine acceptance. And we have for Poland and Romania also provided support on the ground. Now, when I just summarize the lessons that we have learned, is that we definitely have to work on our preparedness. I think that's a acknowledgement that everybody had, or a conclusion that everybody had come to, more or less. And on the surveillance system. So these will be the big areas of work in the coming years. But also it's very clear that the future preparedness plans need to be multi-sectoral and multidisciplinary, really in a holistic way. And we have also learned that the preparedness plans cannot, focus on one threat, but needs to be transferable to others. Such as the emergence of new pathogens or antimicrobial resistance. Now, we have to look, in order to support our preparedness, into the future, as difficult as it is, because the world is changing very rapidly, and the developments that we are seeing becoming increasingly complex. That means a very holistic view is also needed here, because there's the climate change, there's globalization, there's urbanization, technological, geopolitical developments, and economic developments. And all of this will have an impact on what kind of pathogens we will be dealing with in the future. Now, we have set up a dedicated foresight program for this, and we have, as a starting point now, are in the process looking into how to identify and assess factors and trends, and that could be drivers for potential future evolution of infectious disease threats. And these drivers, we hope we will still get a report by the end of this year, so that for the middle of next year, we can come up with some scenarios, how the future could, what could be the future threats, so that we can also start discussing what certain of these scenarios would mean in terms of our preparedness. So we want to develop this into a structured and continuous process for horizon scanning, because if we look now today, the world is significantly different, the landscape is different years ago. What we want that we have then really concrete interventions that we can prepare for. Now, you are aware that we have hopefully soon a new mandate. The text is already clear, but it's still not published. But I hope that latest beginning of January, this will come into force. And there are several new features in this legal text, although it in general still focuses on infectious diseases. But it will give ECDC a stronger role in the areas of surveillance, early warning, and preparedness and response. In terms of surveillance, I mentioned it before, we will have to look into how we can use digital tools to help us achieve our surveillance objectives. The response planning is something that we will do together with Uppsala, Ireland is falling. Together with you, we will also establish a EU health task force to support you even more in this hands-on and on-site if you request so. The new features include a network for EU reference laboratories, and where the Commission will be the institution appointing and financing them, and we will run it from the content perspective. And also a network for of national services supporting substances of human origin. What is also new is that we get a mandate to monitor health capacity and indicators and expanding our work to the prevention of communicable diseases. And of course, a bigger international role. Now, in this context, we are preparing to work even more intensively and more targeted with the member states, because I feel that our current communication and interaction is very systematic, but maybe not what we need in the future. And I can explain more if there's time for questions. Now, it's very clear that we cannot predict what the next threat will be. We can do what we can. It's very clear when you look in the past 40, 50 years that the new emerging diseases, all, well, the large part, 3/4 of them, came from animals. So for a pandemic preparedness that really looks into anticipating and early detection, it's I think it goes without saying that we have to include animals and the environment into our regular activities, so that One Health really becomes a reality. Because otherwise, we will never get ahead of the game, or even not early in. So we are committed to really work with you in a more intensified way and make sure that we're all prepared and safe together. Thank you.
I'm delighted now next to invite our next speaker, fellow Irish person. Can you please welcome Emer Cook from the EMA? Thank you.
The August Bannet Day, and I hope that Andrea and Pierre will forgive me for speaking a little bit in our native tongue. Tá anos óhas an bheith live aniu. Merci Pierre, vielen Dank Andrea. Thank you all very much. It's really a pleasure to be here as an Irish citizen, I would really much prefer to be in Dublin right now. I left Ireland more than 30 years ago, which means I've actually been out of Ireland for longer than I've been living in Ireland, but I always keep an eye on what's going on. And I have to say, I'm both a proud Irish woman and a proud European, and I think it's important to celebrate the fact that you can be both. 50 years after Ireland joined what was then the EEC. I also have to say that I keep a watching eye on what's going on in Ireland, and I was very proud of the success of the Irish vaccination campaign, with levels of uptake among the highest in the EU. So, of course, I'm not allowed to be biased as the head of the European Medicines Agency, but I watch that with a certain pride. Now, today I want to talk about some of the learnings from the COVID pandemic from the perspective of the European Medicines Agency, and I wanted to talk about agility, data collaboration, and trust, because I think these are the fundamentals of what we have done and what we need to do going forward. I'm not sure all of you know this, but I did work at Ireland's National Drugs Advisory Board, which was a predecessor of the current HPRA, and the NDAB was set up in 1966, actually before Ireland joined Europe, but it was just after the first European Pharmaceutical Directive in 65, and it's the one we still quote, 65-65. So a lot has changed since then, and medicines regulation as a part of safeguarding EU public health has never been more, Ireland fell for me as well, has never been more visible than it is today. And that's largely down to the role that medicines regulators played during the pandemic. I have to say, we weren't really set up to handle a big health crisis, even if, our day-to-day work involves a lot of crisis management. But in the context of COVID, the European Medicines Agency and the whole EU regulatory network, so the medicines and our authorities in all 27 member states adapted really quickly to work together to deal with the pandemic. And we had to learn to be more flexible and agile, because we recognized that if we stayed within the boundaries of our mandate, that wasn't enough to serve the citizens of Europe. So we set up a new infrastructure with a pandemic task force, the COVID ETF, and this pulled together all of the best expertise across Europe to help us facilitate fast decision making by our scientific committees. And experts from the HPRA are key players in these committees. Based on what we had learned from our work during the H1N1 pandemic, we already had a health threats plan, and this allowed us to promptly adapt our processes. So, for example, we set up rolling reviews to start evaluating data as it became available, rather than what we would normally do was wait for all the data to be in before the review would start. And this helped us to reduce our normal evaluation time on the assessment of vaccines and medicines from about a year to less than a quarter of that. So a lot of the work that we did, stretching our mandate, shall I say, during the start of the pandemic has now been recognised in the form of our extended legal mandate. And this gives us crisis capabilities we didn't have before, and it gives us these on a formal legislative basis. So we now have responsibilities on shortages, rapid scientific assessment, and some roles on medical devices, particularly in the shortage areas and scientific opinion area. But we also learned that we have to use data better to assess and monitor how medicines performed in real life. And for example, during the first rollout of the vaccines, real-world data gave us the confidence to allow the use of vaccines in pregnant women, and also to support mix and match strategies. But as a result of our extended mandate, we've set up what we call Darwin EU Data Analytics and Real-World Interrogation Network, which is a pan-European network that will provide evidence from healthcare databases across the EU. So this is again a very important learning, and again translating into our mandate to help us deal with crises, not just with crises, but also with better medicines regulation in the future. And the third big learning I want to mention is about communication and coordination, because this is all about building trust in public health. And I know this is a challenge. It's a challenge at country level because you have to coordinate between multiple agencies and then translate those efforts into simple health messaging. But it becomes an even greater challenge at European level because we're coordinating not just we're across agencies, but we're trying to make sure that we take the needs and concerns of member states into account. One of the things that we've learned is that we need to increase this cooperation beyond our peacetime activities. And what we did over the past couple of years was really to make sure that we had discussions on a weekly basis, even on a daily basis, so that we could anticipate problems, coordinate messages, learn from each other. And so this brings me then to my final point, and this is really about the role, the value, and indeed the power of collaboration. I truly believe that the EU vaccine strategy was a game changer, but it built on these over 50 years of cooperation, and it required a major crisis to make it happen. But through this, we built up a much closer relationship, and our coordination with EU partners such as the Commission, ECDC and HERA became translated into real partnership in practice. And we also created an informal network between our medicines regulatory agencies, and this met every week. And this was invaluable, particularly in the early stages of the pandemic. And now this has been translated into the Executive Steering Group on Shortages, or what we call the MSSG. So we had true partnerships at institutional and agency level, but also at a member state level. So now, as we're coming into the third anniversary of this pandemic, I think we need to be really proud of what Europe has delivered. The pandemic has pushed us as EU agencies and member states to really pool resources and make sure that we can work together as we've never done before. And in our mandate, we see that the structures and processes that were born in response to COVID, we've seen that they're strong. We've seen that they could work very, very quickly during the monkeypox outbreak. So we're really confident that some of the measures put in place are helping us to prepare for future health threats, and we can use them in the context of other health threats, including antimicrobial resistance. Let's be proud. I'm proud. I'm proud of the way we adapted. I'm proud of the way we innovated. I'm proud of the way we evolved and supported our citizens. But I also know that we still have some gaps and shortfalls, and we need still to learn from our experiences. And we need to keep this at the center of what we're doing, because it's very, very easy to lose the momentum. If we're going to learn to act now, to make sure that we will be more resilient. Partnerships with countries, with agencies like ECDC and HERA are key to making this happen. So, Garamila Mahagat, merci and Dankeschön. Thank you.
Thank you very, very much, Emer. Thank you. That was very insightful and also very relevant to our discussion here today. I think the time allows for one question from each of our keynote speakers. So, Andrea, I might start with you if that's okay. And I know you spoke about, your new mandate, which includes a lot of different elements, and you talked about targeted engagement, new surveillance, digital tools, and many aspects of it. But going back to the engagement, could you expand a bit more how you think this targeted engagement is going to assist with increasing our collaboration and partnership and help with our work plan for the future.
Yeah, thank you, Breda. We have already tested this, some models for such a different way of interacting. And we used, at the end of last year, we used it for approaching those countries that had a lower vaccination coverage than the EU average for COVID. And so what we did is I actually approached directly the directors of our competent bodies and the national coordinators, and they invited them for the meetings, experts as they saw fit, and then we listened. So one of the key elements that we have to introduce from our side, I think, is listening to what member states analyze themselves is the situation. So we listen to the countries, why they think they have such a low vaccination coverage. And after talking to 11 of those, we came out with certain points and aspects that were very specific for certain countries, but also aspects that were affecting them all. So that led to, for us, that we could target interventions for certain countries where they said are dissuading the patients from the vaccination, that we had seminars, actually together with the EMA, so that we covered the safety aspects and the epidemiological aspect for GPs. In Bulgarian, well, it was in Bulgaria, and the other seminar we did together was in Romania. Also in the national language for frontline vaccinators. We approached the press, but we also have now, as a result of this process, some bit midterm action. We have developed a train-the-trainer course for healthcare professionals that actually should be trained in having these sometimes difficult conversations with the people that come and have doubts about vaccine. So I think this could be a model, because it was very much appreciated by the countries, and I think it could be a model how we interact. And by the way, we also had a seminar with these 11 countries where we invited 2 other countries with a high vaccination coverage, and one of them was Ireland. So that also this exchange could be a mode how we foster that everybody can learn from each other. So that's just one example. We applied, by the way, the same model now for the countries neighboring Ukraine, for developing targeted material that they could use in supporting the refugees. And I think for me, it develops as a model how we can really intensify our interaction, and it involves a direct contract from us, because, you know, one of these countries was telling me, you know, Andrea, we are not used to ask for help. So if we are sitting here in Stockholm saying, well, if you need help, please come and let us know, it will not happen. So we have to go, we have to be the ones initiating, and we have to listen more. So that's basically what I mean.
Thank you very much, Andrea. Thank you. So Emer, I was just going to ask you a question really with regards to communications. We are very familiar with dealing with the national response, but being part of a European organisation, giving directives to, you know, many member states, what were the challenges really that you encountered, and how can we mitigate those for you going forward?
Thanks very much, Breda, and I think Andrea illustrated some of the challenges that we had, that, you know, we needed sometimes to have a tailored approach for different countries, which we hadn't really thought of in the beginning, because we're European agencies and we think European, but actually and this has advantages, and it's great in terms of the medicines authorization. You have one medicine that is authorized across all 27 member states. But then seeing how the vaccines were used in different member states actually caused some challenges in terms of understanding the different approaches, which were often, were based on the epidemiological situation. Sometimes they were based on the supply situation. Sometimes they were based on in countries whether the product could actually reach some of the remote areas. But it got quite difficult to have a single voice that would mean something to all European citizens. And I think this is an area that we can work on. We had to think that actually our regulatory voice has to work with the health policy voices. So we had to also understand what was happening from a health policy perspective, and we needed to be able to we need to know what national directives were being put in place, because of course we didn't want to undermine anything nationally, but we wanted to make sure that this wouldn't lead to lack of trust and confidence across other countries. And so I do think this is an area we can work on more. I think that when you're looking at it from a purely national perspective, you don't think of these dimensions. But if you're in Belgium, Belgium is looking at what's happening in France and what's happening in Germany, and anything different is going to undermine the trust and confidence. And I think having that awareness will help us going forward.
Thank you very much, Emer. Thank you. And just finally, I'm just going to ask Pierre to finish this session with his insights. If you could give, what do you think Ireland as a member state, Pierre, if you were to pick one thing moving forward with regards to preparedness, that we should, of the basket or constellation of elements that would be important for you as Director General of HERA, that we engage with and move forward?
I believe Ireland is very dynamic. Ireland is a country which has a lot of resources, a lot of very good researchers, a lot of also startups, companies, dynamic companies. As I told you, as part of preparedness, we need also to have this kind of tissue. We need to have this kind of elements, support from industry, from researcher. So what I would expect from Ireland is simply just to continue to be part of HERA, to support HERA, but more fundamentally also for your companies, for your researchers, to be fully associated with the work of HERA, because we need you to prepare the future.
Thanks very much, Pierre. So I'm just going to hand over to Sarah now. I think we're going to be inviting our panel members.
Great, thanks all, and thanks for bearing with this this hybrid approach to our keynote speakers. We're delighted to have had Emer and Andrea joining us online. Thank you very much for participating. Thanks also to Breda and Pierre. So we're going to move on to the second part of our engagement this morning. So I'm just going to invite our panellists to come up on stage. Pierre, you can stay with us. Panellists, and Muireann O'Connor, our Assistant Secretary, is going to facilitate this next discussion.
Thank you. Welcome all. It's a real pleasure and a privilege, as Breda says, for us in the Department of Health to host this event today, celebrating 50 years of EU membership for Ireland. And I think it's right and proper that we take these opportunities to reflect back. And in the context of Irish history, I see our membership as coinciding with very significant and very, very positive changes for Ireland. I was born in 1974, so I kind of regard myself as first generation EU in Ireland. And as a civil servant with a keen interest in history, I associate our membership in fundamental change in Ireland's approach to international engagement more generally, and a change in the ambition and in the outward look of our civil service. I suppose post-independence, and for those decades following, and particularly in the 30s, we pursued sort of an insular self-sufficiency and avoided the sort of interaction with the international. And I think that really reached a kind of a low point. The futility of the pursuit of self-sufficiency sort of came home and really, really registered strongly in the 50s with huge immigration and with huge sort of employment challenges. And the country was really, really very clearly falling behind our neighbours right across Western Europe. So from the 50s onwards, the Irish civil service, I suppose, recognising our interdependence and vulnerability in a world that was being transformed through the continual advancement of knowledge, faced outwards. From this came a greater intentionality about our development as a country. And then we had the first and the second economic programmes in 58 and 62. We had a very substantial investment in education. And our proactive and concerted efforts to join the European economic community at the time through the 60s was a core and essential part of those wider modernisation efforts. Sean Lemass, our Taoiseach, Prime Minister at the time, in 1962, in launching the team to look at the investment in education report, spoke about framing development programmes aligned with our requirements as a progressive national community. And I love the simplicity and the plainness of the language used at that time. Actually, it kind of lacks the waffle that we sometimes has crept in sometimes around. There's a sort of simplicity. And I love that concept of a progressive national community. And really, in many ways, when I think of the EU, I think of the EU as a progressive international community. And I really have enormous gratitude as an Irish citizen for all that our membership has done in terms of modernising and liberalising our approach. I'm thinking the human rights elements. I'm thinking gender equality, a huge area where the EU has contributed. And in fact, I recall, well, I was one or two, but the marriage ban existed at the point of our application to the EU. This is where any female employee of the civil or public service had to relinquish their employment upon marriage. I think it may have been motivated by an instinct to distribute employment, scarce employment across households, but it was so obviously discriminatory in the gender area. And in terms of gender equality and in the wider terms and conditions of employment, in environmental standards, we owe a huge amount to Europe. And I'm not just saying we received all these. Ireland has contributed to the wider international evolution of thought in these areas. So, as I think our first session has set out really, really well, COVID-19, I think, has certainly illustrated and demonstrated the EU's value, the value of EU cooperation in terms of the shared challenge of health security. We've heard talk of the vaccine strategy, and that purchasing power was absolutely vital, particularly for a country such as ours. The digital COVID cert, and all these developments gave a real confidence, I think, and I really detect new levels of ambition around health in the European Union. You see that in the European health data space, in the ambition to develop Europe-wide summary care records and e-prescribing. And I'm conscious that long before COVID, there were very significant health developments. The EHIC card, a very simple little card that we carry around, but it's a magnificent when you think about what it is. It offers us equivalent access to emergency health service right across the 27 member states, and it's vice versa for anyone. That's a huge development, and one I think that Europe now wants to build on. Medicines regulation, food safety, all the stuff I think a lot of us took for granted until Brexit revealed how important the small print on the back of our packages is. Cancer strategy is another area where we see huge ambition, the pharma strategy and health technology. So I won't go on much more, but I just want to sort of acknowledge, I suppose, my own pride and the department's pride in Ireland's membership of the EU over the last 50 years and look forward to the next 50 years and what we can collectively achieve for the generations to follow. This EU50 series has been a tremendous opportunity to reflect on Ireland's EU membership, and today I'm delighted to have such a great panel to reflect on EU membership from health research and pandemic preparedness. And I suppose coming from such fantastic speakers reflecting on the European context, I think in this session we want to anchor it in the Irish context and on our involvement in EU initiatives and in healthcare and pandemic preparedness. So it gives me great pleasure to introduce my panel. Beside me here is Professor Cecily Kelleher, College Principal, UCD, College of Health and Agriculture Studies. Cecily was a member of the Public Health Reform Expert Advisory Group, report due out before the year end, I understand, and also was centrally involved in the nursing home review around COVID. Dr. Mairead O'Driscoll is the Chief Executive Officer of our Health Research Board, and as everyone I think will know, the Health Research Board is the primary funder of health research in Ireland, and Mairead will be able to talk about the huge importance of the EU in the context of health research. And then Dr. Maureen Boland is our National Clinical Lead in the Health Services for the Health Threats Emergency Preparedness Programme for the HSE. And of course, Pierre is still with us, Director General of HERA. So I think in the original billing we had about an hour for this, and I will I'll host a panel discussion with our guests for about the first 30-40 minutes, and I do want to allow hurry up. Okay. I would want to allow time for questions at the end. But I just want to start with a general question, and Cecily, I'll start with you first. What does the development of the European Health Union mean for Ireland and for your work?
Thank you very much, Mirish, and good morning, everybody. It's a privilege to be here and to be sharing this audience, many of whom I recognise have had a pivotal role throughout the last 3 years. Like you, Mirish, I was born a bit before you, but I grew up in this country with the European Union. It has, as the CMO said, radically transformed our lives that we have had membership of the European Union. It has changed everything to do with the infrastructure in our society. The frameworks we've been hearing in terms of legislative aspects have all been hugely significant. And so I think that the free movement of people, of trade, of ideas is so important to us. And we see how much we value that at this time when we see crises on our borders and when we have to transform how we go about our preparedness into the future. So this is a huge advantage to us.
Thank you, Cecily. And what for you is the single most important lesson learned from our COVID-19 experience that can help us improve our preparedness for future health crises?
Well, I'd have to say that I think teamwork and harnessing of skills towards a common goal was a crucial part of this whole piece. We have heard, and again, as the CMO said, that NEFIT, NIAC, the response of the HSE, but also cross-sectoral engagement was huge throughout this. Everybody played their part. Everyone said, I'm in this and I need to understand how I can contribute to it. And I haven't forgotten the mask. And I do think it is very important that we do recall that we are still grappling with COVID. I was very struck with the point that was made that 3/4 of the pathogens are emerging from the animal world. So I'd have to stress the importance of One Health here. And as a third-level educator, I can say that we are very much looking to doing that in terms of resourcing and educating the new generation of people who will practice as doctors, as vets, as nurses, as healthcare professionals across the disciplines. We absolutely need a healthcare system similarly that would respond to that. I think it's really important that we would capitalise on what we're doing. I absolutely applaud what is rolling out through the HSE in relation to the framework for public health, the importance that has been placed on it in the last years, the rollout of the consultant specialist appointments, the multidisciplinary teams. This is all crucial. But we also have to have an eye to the cross-sectoral and interdisciplinary aspects of public health.
Thanks a million, Cecily. And in relation to One Health, actually, I note with interest that your college is for health and agricultural sciences combined, so it's interesting in terms of the contribution. Mairead, thanks a million for joining us. And can I ask you, in the area of health research, what the development of the European Union means for Ireland in your work?
Well, thanks very much, Mairead, and I don't know if I should be admitting it in public, but like Cecily, I do very well remember us joining the EU and the excitement at the time when we were at school, and the pride I think that everybody took in our union. I think, as we've been hearing this morning, a lot of health problems and challenges, as we've heard, I mean, they can only be addressed by international collaboration, by cross-border collaboration, and by partnership. Of course, the pandemic's a very good example of that. Climate change would be another one. So, I mean, research is essentially global. So being part of the European Union is absolutely, or has been really, really essential and crucial for us, and really important. And we also know actually that a lot of the best research is just done by international teams working together. That's what produces the best outcomes. So I suppose for a small country like Ireland, at a practical level, being part of the EU has given us an opportunity to work on a bigger scale. It's allowed us access to greater resources and expertise, and I think it's just generally raised our whole level of ambition. You know, it's sort of given us, I suppose, you know, raised our horizons a little bit, just helping us to internationalise our research. So I suppose if you think of a couple of examples of that in relation to COVID, we had clinical trials, the fact that, you know, being part of the EU and, you know, allowed us to participate quickly in much larger trials, better quality trials. So you think about something like the 1 Million Genome Project, which will allow sharing of genomic data across borders. That will allow us to address health challenges, more personalised medicine approaches, and so on. Or the FIRI project that people might be familiar with, which is all around the infrastructure to support public health information. So I think we, you know, we have a huge amount to learn from. We have learned a huge amount, and we've benefited enormously. I think it's important to say as well that we've also brought a lot as well. So we shouldn't just assume that because we're small that we don't have a lot to bring to the party as well. You know, and areas like, you know, public participation, or public and patient participation in research, or how we translate evidence into policy. We're members of Science Europe in the HRB, and, you know, we sit on a lot of working groups, so we find that a lot of countries are very interested in the approach that we're taking in those areas as well. So I think pretty well everybody benefits.
Yeah. Thanks, Mairead. Thanks a million. And to Maureen, Maureen, thanks a million for joining us, and in your role as health threats emergency preparedness for the health services, I'm sure the European Union has come into the frame very in an all-encompassing way. And can you speak to the lessons and the interaction with Europe in the context of our own health preparedness?
Yes, certainly, Mairead. And from the public health point of view, we very much welcome the development of the European Health Union, and I've been part of the advisory forum for the past year and watched the developments and the progress to date. It's so important for us to be optimally prepared to be able to detect early signals of serious infections, to be able to appropriately respond, to rapidly recover, and then to feed the lessons learned back into our systems. So I think it's clear now more than ever that we need this European Health Union as we progress through the COVID-19 pandemic into this transition phase, as we have experienced other crises, such as managing the health needs of the Ukrainian migrants coming into Ireland, as we've dealt with the monkeypox virus epidemic globally. And I think on the horizon, we see extra and other additional health threats out there, re-emergence of really what would have been old infectious diseases such as polio, diseases such as diphtheria. We know that measles is on our radar globally from the WHO. So we also have, of course, very, very serious high consequence infectious diseases such as Ebola, a low risk for us in Ireland, but of serious impact if that happens, and we really very much need to be prepared. So we rely on the European Health Union for their support in this, and we have had lots of engagement, of course, with the EU, with the different sectors, with the ECDC for rapid risk assessment, daily threat analysis over the years. We're on EU consortia such as Joint Action Healthy Gateways, trying to strengthen our preparedness at points of entry at Ireland's ports and airports. And then we're also part of EU Sharp, which strengthens our international health regulation preparedness across chemical threats, across biological threats, radionuclear threats. So all of this is a foundation for us to progress into being part of the European Health Union, which we very much welcome and look forward to working with colleagues in this.
Super. And is it fair to ask you what's the single most important lesson that we've learned from the COVID-19 experience that can help improve our preparedness in the future?
Yeah, so I think the most important lesson learned that I take forward is the need for an expert-resourced public health function to be prepared for the next crisis, which we know is inevitable. So before COVID-19, public health, I think we would agree, were invisible to a certain extent. And since COVID-19, the value of a resourced, trained, experienced expert on the ground public health workforce has been very much to the fore. So I think that we need to strengthen what we've learned from the pandemic with the COVID-19 response from public health, and we have done an interaction review actually of our health protection response to the pandemic during 2021, which is actually we're actually an outlier in Europe. Many countries haven't done this. It speaks very much to our strengths, but it also identifies our weaknesses and areas for development. So going forwards, I think the lesson learned is to value and resource our public health team across the different, the different roles in immunisation and surveillance and early detection response, and my areas of health threats preparedness, and also across the different disciplines, public health medicine, infection prevention control nurses, the importance of surveillance scientists, of all those different technological experts such as behavioural insights folk, and also statistical modelling, for example. So this, for me, would be the importance so we can be really fully prepared for future threats.
Thanks. Maureen, yeah.
In terms of important lessons, I think from a research point of view, I mean, that being able to have good quality research data and evidence and being able to access it quickly was hugely, hugely important. And what we really found was that where we had invested over the years and we had the kind of infrastructure in place and we were able to pivot very quickly, that really stood to us when the pandemic hit. So I think there's a real lesson in that for us, about thinking ahead, planning ahead, investing now. You kind of got to invest, I think the term, maybe it's Brady used the term peacetime, you have to invest in peacetime so that everything's in place and then you can turn it on quickly. And we found that, for example, with our evidence investment, with our own evidence centre, with the CISER group, with other groups around who are able to turn their hand fairly quickly to synthesising evidence, and also where we had, for example, a clinical trial network in infectious diseases already established that was able to start running trials and therapeutic trials and vaccine trials and so on. That really, really stood to us. So I think that's a really key message for us.
No, absolutely. I was struck by how the research community were able to absolutely cooperate and accelerate the kind of timeframes and turnarounds. Pierre, I'll come back to you in a minute. I just want to loop in on some more focused lessons from our own experience of COVID. And Cecily, I mentioned that you were a member of the nursing home expert group and reviewing aspects of the COVID response in that context. And what are the most important lessons arising from that work towards protecting the most vulnerable against future health threats?
So, as we all know, we were dealing with an unprecedented pathogen, a highly contagious pathogen that inordinately affected older people, affected people with vulnerable healthcare needs, and people in congregated settings. So this was a truly terrible experience which we had in this country and across the globe in relation to this. But I think we took three key lessons from it. First, that we needed an infection prevention and control framework that reached out and was effective in congregated settings. Secondly, it threw a spotlight on the need for integrated care models for older people in our society. There will always be a need for long-stay care facilities, but there also needs to be a comprehensive approach to ageing well in the population. And we saw that with the response of the COVID-19 teams, now the community support teams. We need an integrated, interdisciplinary approach, and we need to resource and support healthy ageing in our population. So I think that was a very key second lesson. The vaccination programme, as we have learned, was indeed a game changer in this particular setting, and that is a very big lesson for us in terms of managing winter preparedness and managing long-stay care for older people. And finally, it threw a spotlight on the need for legislative and governance frameworks. And I would say that in my experience on various, over the years, engagement I've had on expert panels, this one, the Department of Health, the HSE, HICWA, took up the mantle to implement those resources. And we had a very comprehensive report published in June, which shows that there has been much progress, but much more to go.
Yeah, super. And I totally, what you say resonates really strongly about the wider lessons of our response. And I think the vaccine programme, I think from my point of view, the importance of organised data, of identifiers that people understood and could provide was hugely important. And we're developing fresh legislation capitalising on those lessons and organising health information in clear ways. Mairead, you've spoken very well about the important contribution of research in the context of the response to the current pandemic. And how is Irish research and academia contributing to preparedness for the next health threat or health crisis?
Well, there's a huge amount going on, as you know, and I think people are looking at it from a number of different angles. I mean, first of all, in terms of the whole evidence piece, which is very, very important. One of the things we're very, very keen to do is to kind of map out our evidence kind of ecosystem, if you like, so that we can see what's out there. Because while we're a small country, which means that when people need, they kind of know who to go to access information in a hurry. But nevertheless, you can't really rely on that either. You want something to be a little bit more formal. So, for example, we're working at the moment with the Global Evidence Commission. They're led by McMaster University in Canada, who are looking at how we can improve the use of evidence, both during normal times and also in for future crises. So, and they're looking at how we can review our evidence infrastructure and map that out and strengthen it. So I think that's a very important area. We're also looking at it from the point of view, as I mentioned, the whole infrastructure around trials and therapeutic trials, building up our trial networks and so on. So we're involved, for example, in the Vaccelerate platform trial, or trial platform for the monkeypox virus and others. I think there are other ways we're looking at it. Earlier, I think somebody mentioned the whole One Health, and Cecily just mentioned the One Health approach. We have a nice model there with our approach to antimicrobial resistance. It's looking at the way both animal, human, and environmental health is all kind of interconnected. And that approach, where you work, with the department here and with agriculture and environment and the related agencies are all working together, it's actually a real strength. And I think that's a very good approach as well. So I think there's a lot of other things going on, and one of the things it did do with the pandemic also threw up some of our weaknesses, I suppose, and it kind of exposed some of the gaps. And we do undoubtedly have a gap in the whole area of modelling and public health modelling, and so that's an area that we're looking at, and I know we've been talking to yourselves about it, we're talking to other agencies like SFI about it, and it's an interesting one because while we think in terms of public health modelling or we're thinking about infectious diseases, of course it's much broader than infectious diseases, and also it brings in a lot of expertise and disciplines beyond public health. Of course that's at the heart, but you have to bring in the mathematicians and the computer scientists and the geographers and all the other people as well. So we're really hoping to put something sort of concrete in place in the next sort of 12 to 18 months, working with others around that. So, there's just some examples.
No, and I loved how the various disciplines that kind of never really maybe saw a link with health, like kind of ran to the fire, I think, around the COVID response. Mathematicians and statisticians, our Central Statistics Office, and all the other agencies of government. And I know there's a good few departments represented here today, and it's maybe an opportunity for the Department of Health to just repeat our appreciation for the enormous support and then the work carried out right across government. It was way beyond health, even though it started as a health issue, I think. Maureen, a similar question just in terms of strength. What should we strengthen now in the Irish context, in the context of the health services, to ensure our preparedness for future threats, in your opinion?
So, I mean, I think there are many elements that do require strengthening, and they vary from the ability of early detection, strengthened and coordinated information technology systems, not only with a case and incident management system, for example, within Ireland itself, but also strengthened information systems with our colleagues in Europe across health protection. So we have early, rapid, agile information that gives us signals and data for action and for preparedness. So we're primed for threats for the future. I think this, we've seen the usefulness of our early warning and response system under ECDC, and we also have the international health regulations systems under WHO, and I think further integration and capacity building, I know, is afoot with the European Health Union, with tenders going out to strengthen and increase that. In terms of then of capacity and capabilities, I guess from the emergency preparedness model, there's a logic model which sets out in quite great detail, developed by ECDC, what do we need to be prepared. And it's important for us that we measure preparedness, that we know what level of preparedness we are at. So I think we need to further strengthen that. We know from WHO monitoring and evaluation framework that across Europe, the preparedness level is somewhat lower for chemical threats. It is somewhat lower for radionuclear threats. And there's also the risk communication and crisis communication element of our preparedness and our response also needs to be strengthened. So this is something, these are lessons for us in Ireland as we move forward to future prepare. We've developed a health protection strategy 2022 to 2025, and some of the lessons learned from our interaction review have been put into that. So there's strengthening under the areas of communication. That's information, advice and guidance to make sure that it actually is acceptable to the population, that it is understandable by them, that it is rapidly available to them, and that it provides an impetus for behavioural change. So we need to make sure that what we do affects the way people behave, so that the response is a participatory element as opposed to from top down. And we also need to listen to the bottom up. We need to have community participation, I think, and this has come out from some of the emerging research on COVID-19. We know that HERA have identified the 3 priorities, and these are elements for us to focus on here in Ireland. Priorities of pandemic preparedness. We need a fit-for-purpose pandemic plan here to work from. Obviously AMR as well, and then the chemical, biological and radionuclear threats. These are priorities for Europe and consequently priorities for Ireland, so we need to strengthen those also.
Very good. Thank you. Thanks a million. Pierre, thank you for your patience and for your excellent contribution in the earlier session. So HERA was established in response to lessons learned from COVID-19, and as you say, in sort of furtherance of Europe's preparedness for further challenges and crises. You haven't had to wait very long for further challenges and crises, I would think, when you think about monkeypox, the Ukraine crisis, Ebola, and how have you been working with member states to address these crises, and how have the lessons from COVID informed your approach, HERA's approach to these?
Thank you very much. First of all, don't apologize for asking me to wait, because it was very interesting what I've heard, and that's confirmed what we need. But I said that we need actually to work at national level and European level. So it's not, either one or other. It's both of us. We need to do that. So that's very important. Second element, as you said, we would have preferred ERA to be created in a very, quiet way, no crisis, just waiting for, a long time before the next health crisis. Unfortunately, as you say, it's not the case. And that's coming back to one of the points I said before. Health crises are there and will continue to be there. Simply, that's a statement. If you look at the number of possible health crises during the last century, and if you look at the number of possible health crises during this century, you have many more possibility of health crises during this century than before for the previous one. And we are only in 2022. So health crises are part and will be part of our life, unfortunately. Now, what you say and your question about the collaboration with member states. You know, I don't believe that what we have done on monkeypox or what we are doing on Ukraine would have been possible without the COVID crisis. Because coming back to what Breda said actually in her speech, you know, if you look at the treaty, it's a shared competence with a lot of competencies for member states. And I believe there was still a perception before the COVID crisis that, you know, when there is a crisis, it's dealt with at national level. We focus on national level. Because of the COVID crisis, member states have understood that we need to work together. And that has been the attitude in the monkeypox situation, in the Ukraine situation, Ebola so far. We are lucky nothing is happening in Europe, but still we have to be very careful. So I believe this, for me, that's the most important message. That now there is a clear understanding by all member states that they need to work together and they need to work with ERA, with the European level. If it's not the case, it will simply fail.
Yeah. And we're going to go to the audience for a Q&A now, but I'll come back to Pierre. How can Ireland best take advantage of the opportunities presented by the establishment of HERA?
You know, as I said we have a budget, which always is good, you know. We have a budget, we have funding capacities. When we look at our funding capacities, we have quite a lot of money investing in research and development. And again, you have explained how Ireland can contribute to this. And I believe this is one very important, research and development. Second element, we need to look at, you know, innovative solutions, you know, innovative products, innovative production capacities, and so on. So again, Ireland is being a very dynamic country. I believe you have a lot of opportunities there. And in this context, I would like to tell you, some of you already know, that we are going to create, very likely beginning of next year, a new fund, which we are going to call ERA Invest, where we will have public money, but hopefully also private money joining it. And the idea would be to use this fund, this ERA Invest, to finance actually new companies, or just to help companies to grow and to come up with new products. And we believe this is something which is extremely important also in Europe, that we have this kind of device which exists in the US, and then we need to develop also to facilitate. And again, knowing the dynamism of Ireland, I'm sure you could benefit a lot from this kind of fund. So, of course, I'm not signing the check today, you know, let's be very clear. But at least I'm telling you, very soon there will be opportunities, and if you are efficient and you are efficient, you have a chance to benefit from those opportunities.
No, and I think you can hear just how much we sort of value the European engagement and being part of a bigger project around health science and human development, I suppose, ultimately. So, thank you, panel. We're going to the floor now. So, raise your hand if you want to ask a question. We'll get a microphone to you. Give us your name and organisation, just so we can. There we are.
Yes, hello. I'm Eamon O'Moore. I'm the new National Director for Health Protection. And on a personal note, having worked in the UK for the last 30 years, very pleased to come home to the EU. So thank you for that.
A refugee, a Brexit refugee.
Economic migrant. One thing that I do want to put into this space today in thinking about lessons learned from COVID plus future planning is the need to think about health equity at the heart of what we do. So we've already reflected on some of the collective challenges seen across Europe, not least of which are often under-researched settings and populations. In the UK, in England, I led the COVID-19 response in adult social care, and we had very complex challenges, not least of which was the fact that those settings were not as well understood as we needed to understand them, and research and evidence base was often poor. I also led work in criminal justice settings, prisons, immigration detention, and a range of other complex settings. Again, characterised by being under-researched and really lacking in the evidence we needed, including not being included in national or international surveillance systems. So I think lessons learned for me, is that no one is safe until all of us are safe. And neglecting these important settings and populations is a real risk in our current preparedness for future threats and could undermine some of the interventions we have now. So it would encourage us all to think about those settings and populations that are overlooked, underserved, under-researched, and usually not represented very well in the evidence base, and to remember that they're the things that maybe will be our undoing if we don't address them fully. Thank you.
Thanks a million, and great to have you back. We'll bring it to the panel soon. I just gather a few questions. Thanks, Michael.
Thank you very much. Michael Power, Clinical Lead for National Clinical Programme for Critical Care. And thank you so much for the presentations. They're so informative. And just by way of a comment or question more for Pierre and for Maureen, in the area of ICU, it wasn't very far. It wasn't every sentence that we heard early on in COVID was for crisis, ICU, and preparedness. And here in Ireland, we implemented a national critical care resilience framework, which operated well for the Irish population of 5 million, which would correspond to an EU region, I guess. And my point is, or my question is, that would it be useful at a policy level, both nationally and also at HERA level, to consider whether there could be regional critical care resilience frameworks that would tie together the existing capacities and the existing structures that are there in order to prepare for an anticipated future emergency event. Thank you very much.
Thanks a million, Michael. Another question here.
Thank you very much. Thank you to all the panellists as well for a very fascinating discussion this morning. Jill Donoghue is my name. I'm from the Institute of International and European Affairs, and I have a question really more foreign policy oriented. One for Pierre, which is to what extent are you involved in international cooperation with BARDA in the US? I know that President Biden has invested a lot in BARDA recently, also for non-communicable diseases, and also with ARIA in the UK post-Brexit. I'm just wondering how research in health fits into that framework. A second question, if I may, was just again to, I think it was Maureen, but Emer Cook also mentioned that we need to move beyond peacetime activities and consider biological, chemical and radiological threats. Do you think that's, or do you not think that's very important in the current situation in Ukraine? And the final very quick one was the politics of migration and health in a pandemic. We noticed that Ireland and Portugal opened their doors to migrants giving free access to vaccines, which wasn't the case in many other member states. Is this something that you consider as well? Thanks very much.
Super. Two more questions up the front here, Paddy and...
Thank you very much. Thank you very much. Hannah McGee from RCSI. I know that the focus of all of what we're doing, of course, is the population. We had lots of good experiences in Ireland, I think, in terms of keeping a handle on what the population was thinking and being able to feed back to the population to address the emergence of misinformation. But I think all of us have been maybe surprised and shocked by the level of disinformation that's available and its potential impact on how the public might behave in any future crisis. And I just wonder if any of the panellists want to address, either from the Irish or the European perspective, what is being done as part of pandemic preparedness or crisis preparedness in relation to tackling disinformation, particularly through social media.
Thank you, Hannah. I'm going to take the last two questions first, the communications and tackling disinformation, and then the radiological threats. Pierre, can you come in first and then I'll bring in Maureen then?
So on the question of disinformation, I believe that's a very important question, of course, because we have seen that, in case of crisis, now social networks are there, and social networks bring a lot of disinformation. And of course, that's not maybe like in the old past when you were, people were simply not connected to the rest of the world. Now we are in a different world. So it's true that because of this disinformation, a lot of people, for instance, have decided not to be vaccinated, or are quite hesitant to be vaccinated, or were not necessarily following all the measures which was imposed by a country. So that's a real problem. Now, there is no easy fix to this, because there is no magic solution, to it. We cannot close the social networks. We cannot stop people to talk to each other. So we really need to find a way to better explain what we do. And so probably the best thing is simply just to be as open and as transparent as possible in our communication, and to give all the facts. Because if you don't give every information, you give the feeling that you're hiding something. And we need also sometimes to admit something which, we didn't know, or things were not, no. Just to give you a very concrete example, and I will be a little bit more langue de bois, a little bit more concrete. You might have seen now that there is a debate, because suddenly some people have realized that the COVID vaccines were not preventing transmission of the COVID, but were actually preventing you to get too sick and to die at the end of the day. That was already known for quite a long time. And actually, probably EMA is no longer there, but when the authorization were granted for the COVID vaccine, it was clear that they were granted to protect people to become too sick and to die, at least to try, but not preventing transmission. But suddenly now, there is quite a polemic, and people have discovered, you lied to us because we took the vaccine because we thought it would be preventing the transmission of the COVID, which was never said. But now there is, again, some kind of disinformation saying that governments and people in charge have lied to the population by giving this false information. So my point to this, and that's coming back to your question, we really need to maintain the facts, to be as transparent as possible, and when we don't know an answer, we need to know that we don't know the answer, but still, it's better, what are the pros and cons of something. But it's difficult, It's really difficult. If you look at all aspects, it's very difficult. If someone has a magic solution, we buy it. So as ERA, we are willing to invest part of our money for such a magic solution, but it will be complicated.
Pierre, just if you quickly, the US cooperation with US or Europe's cooperation more globally, is that something that you're looking at?
Yeah, because we again, one of the lessons of the COVID crisis, is the fact that we live in a global world. That's obvious. I told you about the Omicron. A year ago, Omicron was detected in South Africa. We, European Union, decided to close, maybe you may remember, we decided to stop all the planes coming from Africa going to Europe, Yeah. It took us 2 weeks before we got actually the first case of Omicron in Europe, and it took us 1 month before Omicron was everywhere in Europe. So we live in a global world, so we cannot ignore the rest of the world. So to come back to your concrete question, yes, we have a cooperation with BARDA. We have signed a memorandum of understanding actually with HHS, but so, we have close contact with BARDA, and actually one of my colleagues who's just sitting behind you has been spending a week in the US talking to different people just to see how we can make it concrete. Because, signing a memorandum of understanding is one aspect. What is really important is what kind of concrete project. We are talking to Japan. We will have also probably a memorandum of understanding with Japan. We are talking to Korea. We are talking to Africa. We are talking to WHO. And we are talking also to private sectors, but when I say private sector, I'm talking about organizations like the Wellcome Trust. We're talking to Gates Foundation. We are talking to CEPI. So we really want to create as much cooperation as possible at global level, because that's the only way if we can be better prepared for the future. And I see the message that I need to be short, so I stop here.
Okay, I want to come back to some of the earlier contributions from the floor, and particularly the health equity question. Cecily, it's a really, really important point that we are so interdependent as individuals on the immediate community around us, and how can we adjust our health system to embrace that reality?
Well, I think, first of all, we do need to adjust our health system, but it's not just the health system. Equity is a fundamental principle of public health, and essentially we have been looking at health inequalities across the spectrum. We've heard earlier about obesity, for instance, and the means of tackling that is a cross-sectoral approach which would support healthy eating and affordability and infrastructure and all of those. But I think specifically in relation to the recent experience, we heard earlier, as I said, about the nursing homes, but also the meat factories. We need skill mixes that are appropriate in those settings and appropriately remunerated. This is a very important fundamental thing. And I would single out one specific group because I believe that next week we will see a new traveller and Roma health strategy, and I think it's absolutely crucial. I had, again, the privilege of being involved in the All-Ireland Traveller Health Study, and we absolutely need to address those in our community that require support across the spectrum.
Super, super. And one of the things I would hope myself is that the Sláinte Care approach, the implementation of regional health areas, population-based approaches, will allow for that sort of greater focus on community health.
And in a fully integrated way.
In a fully integrated way.
Engage all the parties, because we need a regional strategy, but we also need to integrate that with general practice, with hospital services, and we do need means of looking at health variations, and this goes back again to the importance of health intelligent health information systems and timely surveillance.
Perfect. That's probably a lovely link to pass to you, Mairead, just on the health equity question, the value of information, or any other aspects of the contributions from the floor that you might want to pick up on.
Yeah, I absolutely take the point about inequity, and at various times we have supported and funded programs of research looking at health inequality, but they've tended to be, I suppose, more generic. I think, as Cecily said, it needs to be something that's embedded much more in the work we do, and I think we do need to invest more and look at that research into deserved or under-resourced areas like that. The other thing I wanted to pick up on was the whole area of information and misinformation, I suppose. A lot of this does come down as well to trust. I mean, whenever we've looked at studies, we found that actually Irish people, for the most part, do actually trust the science, and I think we saw that in the pandemic. People were very interested in the science. And they did trust it, and we saw that, I suppose, in the uptake of vaccines and so on. But it's not something we can at all take for granted. And I suppose, particularly as we say, in a global world and with social media and so on, it absolutely isn't something we can take for granted. And a lot of these questions are very complicated. So we have invested in it during COVID. We invested in a pilot project called iHealth Facts, led out of Galway, to sort of try and address some of the misinformation that's out there about COVID. And certainly now, sort of in the future, we're aiming to put that on a kind of a more on a sounder footing, and to actually change it from a pilot into a fully funded programme. So that again is something that we're taking very, very seriously.
Thanks a million, Mairead. Maureen, I just want to Michael's question on the sort of the real emphasis on ICU, the focus on the quantum of capacity we had at the early stages, and the suggestion, as I heard it, for the development of regional critical care resilience frameworks. Resonates with my regional health areas, which are very much in my mind. But is that some part of the planning that's going on, or is that something you see value in?
I mean, for sure. I mean, critical care was pivotal to our ability to, for the capacity to deal with those people who were severely ill, who maybe required protracted periods of intensive care during, particularly I think the first wave of the pandemic. We know it was a big challenge for us. So certainly for now and for future pandemics and for crises, I suppose, such as potential Ebola cases, we do need strong critical care capabilities within Ireland. And I believe you're talking about within Ireland, Michael, as well as with into European. Are you? Both, yes. So, I mean, from the European point of view, if we look at the need for, say, a high-level isolation unit, such as the Mater Hospital provides, there is a need for, I think, collated working with colleagues across different networks. So we know, for example, Germany has a stack-up network of high-level isolation units that they kindly collaborate with other EU member states in case of need. And I think this is a model that we hope to look further into. We also have had conversations with our colleagues in Northern Ireland, where there's a medium level isolation unit, and also with the Emergency Preparedness and Resilience Response system in the UK, who, you know, our nearest neighbours are clearly the ones most most relevant to us in terms of shorter distances to travel. So I think that critical care is it's a vital component of our health system response. It is challenged always in these pandemic setups. It's challenged in terms of capacity, capability, in terms of staffing, in terms of the patient profile, who they can treat. So I would think it would be a very worthy project to have these regional frameworks, the national frameworks, and international collaborations for critical care.
Maureen, thanks a million, and thanks to all panellists, Cecily, Mairead, Maureen and Pierre. Really appreciate your contributions there. Thanks also, just session one, Breda, Pierre in session one, Andrea and Emer, just for very interesting contributions. Oh, sorry, I'm overlapping a bit. This concludes our panel discussion. Thank you.
Thanks very much, Muirish, for an excellent panel discussion. I'm sure you will all agree with that. So for the excellent facilitation and also the little history lesson earlier on. That was really very welcomed. Thank you very much, Muirish. And also to the excellent panel. I think you will all agree they have given us great insights and answers to very important questions, and also posed some new questions, and also you have also in the audience. So I really thank you for engaging with this in such an interactive way. It's really been very useful. So thank you, Professor Keller. Thank you, Mairead, and thank you also, Maureen. And then also thank you to our esteemed guests, Pierre, Andrea, and also Emer, who have given us a very good insight into our EU infrastructure through which we will be leveraging moving forward, and hope to collaborate in true partnership with these organisations and leaders to help us move forward with our pandemic preparedness for the future. I think it has been, this event has celebrated us as EU members, but also has given us great focus on the requirement to move forward with preparedness. We have just finished with, we're exiting or in a mitigation phase, and as you say, it's not over yet. Our masks are still in our pockets, but we are in the mitigation stage of a pandemic, and our memories are short. But there will be another health threat, and we do need to be prepared. And I think we need to take this opportunity to focus on that and ensure the emphasis remains there, so that we aren't caught in that state of unpreparedness as we were previously. I suppose my final remark, and it is back to one of the key elements, I think, that drove a lot of the transmission throughout the pandemic. And it's one element that I do think we probably will need to focus on in greater detail. And I was delighted to see it being raised as a point, but also to be discussed. And that was that of inequities within our society. I think we truly do need to take this on board and turn our words into actions. As I've said previously, health is not just about the health system. We really do need to move that forward into action plans, and I'm delighted to see the Traveller Health Action Plan coming forward next week. And I think it
it's to our other communities within our society also that are vulnerable and require better support and infrastructure. So thank you all on that note, and I'm just going to thank you all, and we'll leave it there for today. Thank you very much. Thank you.